My back has been hurting, and I wondered if it's normal. Then one of our clients was a spine doctor at Gleneagles. So I decided to take advantage of this by asking him things which I've always been curious about.
In most cases that we see, the back pain is usually self-limiting and it only lasts for a short period of time. In such cases, it's probably due to a sprain of their back muscles. However, in patients with longer-lasting back pain, it could be due to a slip disc, and these patients would usually complain of shooting pain down their legs. In elderly patients with chronic back pain, it could be due to degeneration of the spine in a condition known as lumbar spondylosis. Well, just by talking to the patient and examining the patient, we usually can diagnose whether a muscle or ligament is torn. However, to confirm the diagnosis, an MRI scan will need to be performed. We can usually tell if a spine is misaligned just by looking at the patient and performing a physical examination on the patient. However, to determine the degree of curvature as well as deformity of the spine, a standing X-ray of the entire spine will need to be performed. That is not true. Most of the cases can be treated non-surgically using physiotherapy and a short period of rest. Spine surgery is only recommended in patients who don't get better after conservative management. Nowadays, spinal surgery can be performed using minimally invasive methods. In select cases, these patients can also undergo surgery without general anesthesia. This allows them to recover quicker and get back to their usual active lifestyle. Minimally invasive surgery is essentially keyhole surgery in which smaller incisions are being utilized. This is beneficial to the patients as there is significantly lesser blood loss, lesser post-operative pain, as well as a quicker recovery for the patients.